Hi, my name is Lynne Savino, and I am a physician in Connecticut in the United States. When I am not working, I love to hike, and one of my favorite places to hike is on the Appalachian Trail, a trail that travels over 2,000 miles from the state of Maine all the way down the spine of the Appalachian Mountains to the state of Georgia. On the Appalachian Trail, there are many dangers: bears, rattlesnakes, running out of water, getting struck by lightning. But one of the most ubiquitous dangers is due to a little insect called the deer tick, or Ixodes species, because it is a vector for the syndrome known as Lyme disease. Lyme disease is the most common vector-borne illness in the United States. It was first discovered in about 1975 in the town of Old Lyme, Connecticut, just a few hours' drive from where I live. It was later found that a spirochete, carried by ticks, was the cause for the symptoms of the disease. This spirochete is called Borrelia burgdorferi. So here's how you get Lyme disease. A tick feeds on an animal that has the spirochete circulating in its bloodstream. The tick ingests the blood of the infected animal, and with it ingests the spirochete. The tick then falls off the animal and hangs out on the edge of a leaf or a bush waiting for another animal or human to pass by. When the animal brushes by the leaf, the tick then crawls onto the animal's skin and looks for a place to start feeding. This place is usually an area where the tick will meet resistance, such as the hairline, a fold in the skin, or a waistband or cuff. When the tick meets resistance, it will then start feeding again. As it feeds, it will transmit the spirochete into the new animal's bloodstream. About a week or two later, the animal, or human, will develop symptoms of Lyme disease. What are the symptoms and signs of Lyme disease? The most common sign is called erythema migrans. It is more commonly known as a bullseye rash. Here is a photo of one of my patients that I just treated last week. This rash will usually occur about 1 to 2 weeks after the tick bite. It is usually at the site where the tick is attached. This rash is so unique that if a patient has it, we don't even need to do any blood tests to confirm the diagnosis. We just start treatment right away. Treatment is with a course of antibiotics, either doxycycline, amoxicillin, cefuroxime, or azithromycin. The antibiotic is given for about 10 to 14 days. Patients usually do not progress if they start antibiotics promptly. Other symptoms and signs include fever, chills, and arthralgias, and even neurologic problems like meningitis and a facial nerve disorder called Bell's palsy. If the patient does not present with erythema migrans rash, the diagnosis can be made with a 2-step blood test. This includes an enzyme immunoassay as the preliminary test. If this is positive, a confirmatory Western blot test is done. Both tests must be positive for a diagnosis of Lyme disease to be given. Prevention can be as easy as spotting the tick before it bites. A tick cannot transmit if it cannot feed. This slide shows some other strategies to prevent ticks from finding a juicy bit of skin to chow down on. Wear long sleeves and pants, shoes, and tuck in the pant cuff into socks. Wear a hat. Use some form of insect repellent that contains the chemical DEET. Check for ticks after you have completed your hike, your yard work, or whatever outdoor activity puts you at risk. This is best done after a hot shower, as ticks fall off the body more easily during bathing. If you find a tick, grasp it with a pair of tweezers at the part that is attached to the skin and apply a gentle, constant pulling motion. The mouth of the tick will eventually fatigue and release after a few minutes. High-risk groups are individuals in suburban or rural areas in the U.S. geographic distribution, as shown here. Lyme can also be found worldwide. In fact, Lyme disease is so prevalent in the U.S. that one of our most famous country music recording artists, Brad Paisley, wrote a song entitled Ticks. Go ahead and search it out on YouTube. And finally, here I am, on the Appalachian Trail, walking through a grove of mountain laurel, hoping not to get bitten by a tick. Thanks for watching.